Hello again, everybody. This is Craig Evans of Autism Hangout, and welcome to the first session of Ask Dr. Tony. And I have the good fortune of being able to talk to you and Dr. Tony live today from Brisbane, Australia. Welcome, Dr. Tony.
Oh, hi, Craig.
It's nice to have you join us. For those of you that have been regular members of Autism Hangout and stopping by on a regular basis, you've noticed that Dr. Tony Attwood has very generously offered his time to answer questions from the autism community. And many of you have written in questions. Tonight we're going to be trying to address as many of these as we can in a 10-minute window, but we have 6 that have been submitted from Autism Hangout members, and if Dr. Tony, you're ready to begin, I'll start reading some of these questions.
Okay, Craig, let's roll.
Okay, here's the first one. Dr. Attwood, our son is now 18, and we're having a hard time convincing him that it's time to move on to the next level. He spends most of his time online gaming and chatting and talking with friends all over the country. He works 2 evenings a week, he sleeps during the day, and he hardly eats. How do we help him move forward?
Now, from the description of the situation with your 18-year-old son, he's probably very happy because he's created for him a secure and safe environment at home. I describe that as his castle. And he pulls up the drawbridge, doesn't allow anybody in, and is kept away from the dragons or the invading armies of the socialites. So he's having a happy time in terms of his online games give him a sense of excitement. He's got a social life. He has people that he doesn't have to worry what he wears or social chit-chat, and he can communicate with them through typing, not face-to-face talking. So he's got a social life. It also means that he doesn't have to have contact with his family, because for some teenagers with autism spectrum disorders, they can switch day-night cycle. What's happening physiologically, we don't know, but they will tend to do this. So parents are content in the outside world. They're good at socializing. They feel confident at it. For him, it's an enormous contrast. It's a frightening environment. So basically, he's secure in his home setting, in his bedroom. It cures his autism because, in fact, he has no social difficulties, no communication problems in that setting. It's his cure. Now, parents are past their use-by date for teenagers, and I think the only way to get him to get outside that area is with one other teenager who can give him the confidence, the guidance, and support he needs to have little ventures outside. It's almost like a phobia for outside. It's a fear of social mistakes and ridicule and rejection. Somebody who can act as his mentor, but of his age.
Very good. Okay.
Thank you.
The second question is, Aspies, as you know, are now coming of an age where many can seek independence, 18 and over. Do you know of any successful group homes and how they work or why they work? Is there a pattern that if somebody was attempting to find a group home for their child, is there a checklist they could use? What would they be looking for?
When it comes to group homes, first of all, each person with an autism spectrum disorder is an individual, and they are very clear in who they like and don't like, very black and white. So when you have a group home, it very much is dependent on who they are with. First of all, those with ASD are often quite intellectually arrogant and are not happy with people who are intellectually disabled or very confused by people with psychiatric illness and so on, and don't necessarily get on with people who have the same characteristics. Wherever the group home is, there will need to be a sanctuary for that individual so that there is less of the shared living. It may be like a flat or, should we say, single person accommodation with their separate kitchen, separate bathroom, separate bedroom, but perhaps with someone providing the degree of supervision. But they need their own private area and to have some contribution as to who they are with.
The next question is from an Autism Hangout listener by the name of Spencer Nobleman, and he writes, First, Dr. Attwood, thank you for your book. I'm a 26-year-old with Asperger's, and I have a question. How has autism research been harmed by the war on drugs? And what he's referenced here is, as these psychedelic drugs became popular with the underworld, the research firms were denied the opportunity to do research on it. He's curious as if any of these psychedelic drugs should be brought back for research.
My answer to that is that this is a very complex area. Brain chemistry is extraordinarily delicate, but especially for those with an autism spectrum disorder. We know that their response to conventional drugs can be quite sensitive or paradoxical. In other words, things that should calm them down make them hyperactive. The psychedelic drugs really haven't been sufficiently refined or understood to be prepared to administer them to someone with an autism spectrum disorder, especially if they have difficulty communicating their response to it. So my answer to this is, it's an interesting suggestion, but I'm very concerned about the consequences on brain chemistry. It's very much new territory. I would look for more animal models and explanations of the hypothesis before administering this to those with an autism spectrum disorder.
Very good. The next question is from Lydia, or Lassie is her name online. My daughter is 16 and has Asperger's syndrome. Most colleges want kids to have a foreign language in high school. Is it harder for an AS kid compared to NT kids to learn to use foreign language out of context?
My comment is that those with autism and Asperger's tend to be at the extremes of ability. Whether it be mathematics or spelling or languages, they're either wonderful at it or hopeless at it. On the one hand, I have those with Asperger's who are multilingual and have an ability to understand languages that is intuitive and remarkable in speaking the language without an accent, so that they say it as they hear it, not, shall we say, polluted by where they come from. Yet there are others who are hopeless at it. And what I look at in high school is what I call pruning the curriculum. In other words, if they're not good at it, cut it, because there's no point in pursuing it. If they're good at it, great. So basically, if she's not good at it, naturally doesn't like it, don't do it.
The next question is from listener Weblord. He says, I have a 16-year-old son, an only child with autism, and he spends his time twice a day playing games on the computer. We're also giving him medications for his blood, liver, and memory, and those by name are called Circulant, Liver Aid, and Memory Plus Gold. This is the advice of his pediatrician to treat these sources of autism in our son. Should I continue treating him with these medicines? I guess let's just stop. That's the question right there. Do you believe in these medicines?
Really, they're medicines that aren't necessarily prescription ones. They seem to be probably ones that can be obtained over the counter at a pharmacy. They tend to be fairly low level in terms of toxicity or problems. I can't see any automatic reason to say no to those substances. What we would normally look at in a design is to be on the medication and assess how he is. Have what I call a drug holiday, making sure that everything else is the same. So he's on vacation, for example, and then see after, say, 3 or 4 weeks, if it be the summer vacation, are there any differences? Does he remain the same or deteriorate? Then return the regime and see if the abilities are returned. If not, then, shall we say, it may not be valuable. I don't think it's doing him any harm. However, I don't think it actually focuses on the source. It may affect certain aspects of abilities.
This is the last question from our readers. Hello, Dr. Atwood. Any suggestions on how to handle my 5-year-old? Very large for her age, very strong. She is nonverbal. She has periods of very severe aggression, during which she pinches and she scratches, she hits, she kicks, and she pulls out clumps of her sister's hair. I think you get the picture. We started her on Prozac, hoping to curb some of her obsessive tendencies and perhaps even calm her down. She has been calmer overall, but she's still obsessive. And she's also quite destructive to our home. There seems to be no let-up on the aggression as well. We can never quite read her. During aggressive periods, I do try to give her Tylenol, presuming that she's in pain. We just started a home therapy program, but I'm sad to say that we don't even like this kid anymore. What else can we do? First off, Jackie, don't feel bad about being stressed out about your kid. Dr. Atwood?
That's a very important question, and one that I have in my clinical experience almost every week. one of the interesting things is, yes, those with autism do tend to be bigger. We think something happens with growth, but she's a 5-year-old non-verbal. You use the term aggression. I'm a bit cautious of using that term. I strongly suspect that the root cause is actually anxiety and panic. Now, there may be a feeling of anger because of frustration, sometimes because a compulsion, a sequence, something that she anticipates is not occurring. So in a way, she may be having what I call panic attacks, rather than being an aggressive person. She's trying to survive or cope in her world. This is her way of getting the message across of, I have to have it now because the anxiety is so intense, I must end it. And the only way is to attack, to stop that person or make them do something. So in a way, we need to observe her and help her communication system. We need to find out the things that she wants to communicate and happen in her life by choices. We need a system that she can understand what's going to happen, when, who with, how long, by pictures. So that once she understands the sequence, she knows what's going to happen rather than impose what she wants to occur. And if it doesn't, she's into control and manipulation as a survival mechanism. We also need a program that when she does become agitated, she releases her energy and agitation in a more constructive way. As she's 5, I would strongly recommend programs to encourage her to learn how to relax, but I would see this as speech pathologists and communication, especially visual, as a way of alleviating what I think is confusion in a changing world. She needs to understand the pattern of life and an effective communication system to prevent these, what I think are anxiety, panic meltdowns, rather than someone who is by nature aggressive.
It's clear you have many, many years' experience in this field.
35 years.
Yes. Dr. Atwood, thank you so much for sharing your time and your opinions with us. I can't really express how much we appreciate the fact that you're doing this for the autism community. I know that you're a very busy person. Thank you for talking with us this evening. Skype hasn't been the most cooperative, but nonetheless, the content of your answers has just been wonderful. So thank you again for joining us this evening.
Thanks, Craig. See you next month.
And thank you, Autism Hangout listeners. Please keep your questions coming for Ask Dr. Tony. I hope we get a better connection next time, but the content, as always, is to help us learn and thrive with our kids with autism. Good night.